Hello, everyone. Thanks for joining us. We're scheduled to start at 4 o'clock, which is 4 o'clock currently right now. And it looks like we still have a few more registrants who are still trying to log in. So I'm going to wait another minute or two while they connect before we get started. So we'll get started in about 2 or 3 minutes or so. Thanks, everyone, for waiting.
Okay.
We'll just give everyone one more minute or so. I see a few more trying to log in. Right, I think can get started. It looks like everyone's mostly signed in, which is great. So I think we'll get started. All right, so hello and welcome to today's webinar. My name is Cheryl Bachunitz, Assistant Director of Admissions here at Massachusetts College of Pharmacy and Health Sciences. I oversee the admission for the online nursing grad program. So if you have admission questions, I am your go-to contact person. So I also wanted to just introduce, we've got a great group joining us today. Some of them are going to be coming in as we get going on the webinar, but right now, I'm going to introduce Dr. Edith Claros, who's our mental health nurse practitioner, track coordinator, and I'll turn it over to her. So if she just wants to introduce herself a little further and explain a little bit about her path here at MCPHS.
Thank you, Cheryl. Yes, I am Edith Carlos. I'm the current PMHNP program track coordinator. I have been with the university for about 18 years. I have taught multiple courses, not only across the BSN program, but also the MSN program. Mostly I focus on I actually don't teach at all in the BSN anymore since we transitioned to the PMHNP program. And I have a doctoral degree in public health, served me really well. And I currently practice 1 day a week, see patients in the clinical setting, and maintain my practice current. I teach psychopharmacology. I also teach counseling techniques and coordinate other activities in the program. So thank you so much.
Thank you, Dr. Carlos. That's great. And also joining us today, who are going to be popping in as we continue on, is Dr. Barbara Frechet. She is our Director of Graduate Nursing Programs. She'll be joining us a little later. And then also Professor Michelle Scola, who is our family practitioner track coordinator, and also our nursing specialist, Kristen Watson, will be joining and popping in. So once they join, I'll have them introduce themselves. So again, great, and thank you, everyone.
Cheryl,
Go
allow
ahead.
me to just interrupt for a second. Dr. Frechette is here and so is Professor Scola.
Oh, wonderful, terrific.
Yeah.
And if you could please introduce yourself. I apologize, I don't see the full screen, so please.
Hi, go ahead. Do you want to go, Professor Scola?
Sure.
Go.
Sure, thank you. Hi, I'm Michelle Scola. I am the track coordinator of the Family Nurse Practitioner track here at Mass College of Pharmacy. I have been a nurse practitioner since 2013. I've been with the university since 2019. Being an NP is is the best profession, and we'll talk about that a little bit more when we get into our slide deck. But if you are in the FNP track, I teach the pediatrics and women's health courses. I also teach advanced health assessment here. So that involves both of our psychiatric and our family nurse practitioners. Currently, I practice as well on a volunteer basis in a couple of different settings in the school setting, along with a community health clinic and some other community health settings as well. So it is great because you can, kind of dabble in everything as an FNP. So I'm looking forward to hopefully getting to know you if you end up joining the program. Thanks so much. And I'll have Dr. Frechette step in.
Hi, welcome everyone. We're excited to be here today, to share with you about the school. So my name's Barbara Frechette, and I live in the Commonwealth of Virginia, the state of lovers. And I'm originally from Massachusetts. I actually went to school and got my RN in Massachusetts and then traveled around all of the states. So I have over 40 years, of course, of nursing. I've been in the field quite a long time. I've done school nursing, hospital work as well. I love working with families and children. I did go for school for my clinical nurse specialist in New Mexico, as well as family psych mental health nurse practitioner. And at this point, I'm a consultant for schools. I'm also teach some of the courses in the program when it's possible, and that's it, I think.
That's great. Well, thank you, everyone. And again, as I mentioned, we also have another guest who's going to be joining us from faculty, who's our nursing specialist, Kristen Watson. So she'll probably pop in as we continue on. But thank you, everyone. We have a great group here today, and we are super excited and pleased to be here today to present our university's offering through the School of Nursing graduate programs. So just a quick heads up, just during this webinar, we will discuss information about our university, the graduate nursing programs, how to apply, and then we'll end with a Q&A just to cover any additional questions that you may have. And if you do have any questions during the presentation, please feel free to leave them in that Q&A box that's at the corner of your screen. And we'll answer them as we move along. Or if you want to just save them to the end of the presentation, we haven't answered your question after this presentation, please feel free to go ahead and put it in that Q&A box in the corner of your screen. And one other quick note, that this webinar will be recorded. If you miss anything or need to log out before the end, not to worry. I will be sending you the link to view this recording in about a week or so, and you can review it at your own convenience. So you can see any of those links or screenshots or anything. So look for that. That'll be an email from myself. All right, with that being said, we can go ahead and get started. So first of all, I just want to say huge congratulations for all of you for choosing the healthcare industry as a professional career. As many of you know or already know that the healthcare is a fantastic field to be in right now. According to recent reports put out by the US News and World Report, healthcare is among the largest employers in the US, and the nurse practitioner is actually ranked #1 job in the healthcare industry, according to that report. So this field is in very high demand, and with the aging population, the demand is projected to increase over the next several years. And the nursing practitioner profession is actually expected to grow by 40% through 2031, according to the Bureau of Labor Statistics. So with all that being said, our students are finding job placements soon, right after graduation, and some are even receiving job offers before they graduate. So just kind of goes to show you that we certainly have a bright future in this field. And we realize also that returning to school will be an investment of both time and money. But based on the current job outlook and the quality of the education at MCPHS that we can provide, we do believe this is a great investment for your resources.
I think I'm up, right?
Yes.
Great, thank you. So this slide is just going to talk about a little bit about advancing your nursing career. So first of all, kudos, because nursing is one of the best careers you can be in. According to an annual Gallup poll, nursing has always been the most trusted profession out of all of those that are surveyed and ranked. Every year they've run the poll since, gosh, I don't even remember when it started. The only year they didn't win was during the year of 9/11, because firefighters took that role, and rightfully so. But nursing climbed right back on top after that because, you know, everyone loves a nurse. We all trust a nurse, right? So why not advance that practice to become a nurse who can get an elevated level of education, clinical training that's going to help you work in a specific population here, whether it's your psych or your FNP, which is, you say, cradle to grave, you know, that whole age group from birth to death, and actually be able to assess, diagnose, and prescribe treatments for those conditions, and to build those relationships with your patients that, you know, you can really continue with. So it leads to a lot of opportunities. You know, we have a lot of graduates who practice in a regular, you know, basic settings, and a lot of people who will go into leadership, research, education. So world's your oyster when you get your master's in nursing. Financial stability is huge. A median annual wage is around $120,000 a year, depending on where you are practicing and your level. You probably may not start out that high, but it is a profession where you will be financially stable. A strong employment outlook, as Cheryl just said, you know, the profession is growing. There's a demand, there is a need. Schedule is flexible. You know, you hopefully will put yourself in a position where maybe you won't need to work weekends anymore, or maybe you only work weekends because that's what you want to do. So you'll be able to, you know, find a career where you should be able to work in a schedule that suits yourself, especially if you are autonomously practicing. So a lot of states will actually allow for full practice authority. Every New England state does, Massachusetts does after 2 years of practice. So after, you know, 2 years in Massachusetts, you could open your own office and have your own panel. And of course, the opportunity to specialize. If you feel, you know, after your experience, you're very passionate about a certain area, you know, you could have a specific specialty, whether in psych or in FNP. There's a lot of different niche fields that you can get into. So a lot of opportunity to explore with your degree.
Great. All right. So did you know, who is MCPHS? MCPHS is a healthcare specific university offering over 100 programs in different health science fields. So the university itself has been around a long time, starting in Boston, and we actually just celebrated our 200th year anniversary last year. We are the oldest university in Boston. FYI, Harvard is located in Cambridge, so that's why we hold this honor. But we are also the second oldest pharmacy school in the country. So with that, we really believe that we have a lot of great programs and a lot of great growth since we've grown over these years. And what we just started out as a pharmaceutical program in Boston, MCPHS has grown to incorporate over 7,500 diverse students between our 3 campuses, which are located in Boston, Worcester, Massachusetts, and Manchester, New Hampshire, and our online branch as well. We are a teaching university, and healthcare is our specialty, and many of our faculty are still working in the healthcare field while they're also teaching. And so they will also be well versed in the course material, and they are constantly staying up to date with the current healthcare systems. So a little bit about the online at MCPHS. We have been offering our graduate nursing program since 2019. Originally, they were offered on campus, and then we introduced them online branch and then we introduced the full online branch in 2011, but the nursing program kicked it off. And now we have over 35 online programs, and we have roughly 500 total students studying with us nationwide. Our online programs are flexible. They give you the freedom to continue to work and live your life while you still go to school. Although the programs may be online, our students have access to the same resources as our on-campus students do. You have access to the state-of-the-art facilities, our faculty advisors, tutoring services, career services. So if you wanted to build your resume or do mock interviews, we have the writing center, an online library, counseling services, and so on and so on. So as an MCPHS student, you have all the access that every MCPHS student has.
So I'm going to talk a little bit about the online learning experience. A majority of our graduate nursing programs does consist of a mixture of online courses, clinical rotations, and on-campus residency requirements. So recently, in the past few weeks, we have on-campus residency, and that will be required for spring 2025 and going forward for all programs. And that will take place in Worcester. That's where the online program is housed. And there are 3 residencies. The program is very flexible in that most of the courses students complete are asynchronous, allowing you to access your course material at any time during the week. But there are a few synchronous seminars, students, and that will come about when you're in your clinical rotations. And you'll attend that throughout the duration of the semester, and that will give you access to clinical faculty to help broaden your clinical development. But for the most part, your courses will be asynchronous. Students generally complete an average of 2 courses per term and spend roughly 3 hours per credit each week on coursework. But please note, if you do take less than 5 credits a semester, it will impact your student loans and will extend your completion date. So that's something, of course, you need to consider if you reduce your credit load a semester. Beyond classes, students also partake in clinicals and, again, 3 residency. Now, just there is an exception for the RN to MSN is 4 residencies. They have an additional orientation when they matriculate into the MS program. So the clinicals take place in your own community.
School of Nursing highlights. Just a few highlights about our School of Nursing, or I don't know if any of the faculty wants to jump in and take on this slide.
Sure, I can do that.
Thank you.
So we are a fully accredited program. We are accredited by CCNE. We are actually up for accreditation in 2026. So we are already working on that, but we are fully accredited. So both programs, the FNP and PMHNP program, received full accreditation our last go around. Again, we have multiple program options and they're all offered online. So that is a big pro for people who have families, who are working, who, have a life outside of school, and everyone who works in the program. We understand that everyone who is here also has multiple responsibilities that they're juggling. So, that is something that is a good thing about the programs that we have here. So our 2 tracks, again, are the FNP and PMHNP options, which Dr. Claros and I will kind of go over in the slide deck coming up. You will be eligible when you complete the program to sit for either the AANP or ANCC boards, which are the 2 certification bodies that test for FNP and PMHNP national licensing. Our board rates are very strong. Over 95% of our students passed on their first attempt at our last pass rate, so that we were very excited about that. We have had very strong pass rates in the past few years and even before that. So start dates, we do actually have 3 rolling semester start dates for the MSN programs and also our CAGS program. So we enter in the fall, spring, and summer. So pretty convenient for students who, maybe aren't okay for the spring, but maybe the summer is when they're available and they're ready to start. If you are considering the RN to MSN and DNP programs, we are a fall start at that time period. And as Dr. Frechette said, we are a part-time program, which means, we foster the ability to be able to work during. It is very rigorous still. So we do have some students who opt to go down to one course a semester, depending on what semester it is, if it works, what works best for them in their life, and we are able to support them in doing so. But again, it does have some implications for financial aid and graduation dates. But again, whatever gets you to the finish line is usually what we suggest. So, those part-time, either, usually 2 classes a semester, or even 1 class a semester to get you to achieve your advanced degree.
Thank you. Great. So just an overview of the graduate nursing programs that we offer here at MCPHS, which are, again, all offered online. So we offer a 3-year RN to MSN bridge program for students who already hold their associates in nursing that will go now to the master's program. And then we also offer 2 master programs, both 2 years, the family nurse practitioner and the mental health nurse practitioner track. And these programs are for students who already hold a bachelor's of nursing degree. And we also offer certificate of advanced graduate studies, both in the family nurse practitioner and in the mental health nurse practitioner tracks. And those are designed for students who already hold their master's degree already in nursing. And then lastly, we do offer a 2-year doctor of nursing practitioner program. And that one, again, is 2 years or 24 months. And also just note for the certificate of advanced graduate studies that if you do have any transfer credits, the completion date may vary. So you may complete a little bit earlier. And the RN to MSN Bridge program, I'm just going to quickly just note that this builds on your associate's degrees and for allowing students to get their master's, and it's without earning their bachelor's degree. So just know that you will not be earning a bachelor's degree, you will just be earning your master's degree. The program starts every fall and it is 36 months. And again, just to kind of reiterate, the first year is your bridge year. So you'll be specialized in your RN coursework. It's 90 clinical hours. The second year is more the specific master's coursework. You'll start that master's orientation, hence what we were talking about earlier as far as those 4th residency. So you have that additional orientation for your master's program. And then year 3 again is more the master's work. It's 750 clinical experience for the FNB role, and no prerequisite coursework is required. Dr. Claros?
I just realized that was me. So the students in both tracks, FNP and PNHNP, take the initial courses during that first year, and then they branch off into the special ed courses. So what is the difference between an FNP and a PNHNP? I can speak for the PNHNP, and then I will let my colleague, Professor Scola, to speak to the FNP track. The psychiatric mental health nurse practitioner, again, is a nurse practitioner that specializes in the care of patients with mental health issues across the lifespan. This program, in fact, the accrediting bodies have changed. Initially, there was specialized in just adult and specialized just in geriatrics. So they're moving more to across the lifespan, and our program prepares you to care for patients, anywhere from children all the way to geriatric patients. And your clinical experiences will reflect that. what happens in the experiences, the clinical experiences. You know, it's a progressive kind of scaffolding type of approach where you start out with, learning about counseling, how to talk to patients, how to communicate. And then based on that, utilize your assessment, your skill, laboratory work if you need to obtain it, to diagnose and formulate a treatment plan for those patients. Employment opportunities are super, super, super hot right now. Our students graduate ready to hit the ground. The only thing that's holding them at this point in terms of going to work right away when they graduate is the licensing and credentialing process, which we will discuss, as we get through the program. That licensing and credentialing process can take, a few weeks before you can actually start working as a PMHNP. But all of our students, the great majority of them, they graduate with a job in line, ready to go. And students can work in inpatient psychiatric settings. They can work with children and adolescents in psychiatry, and there's a huge need for that. They can work in prison systems. They can work in outpatient systems, private practice. They can open, and especially in states where there's full practice authority, they can open their own practice. I will never recommend opening your own practice without having some experience, working for somebody else. And usually the inpatient experience is very good. But that's an option that, many clinicians have, is after several years of being in clinical practice, whether it's outpatient or inpatient or whatever, they go on, venture and open their own practice. So lots of opportunities there for PMHNPs. Professor Scola?
Thank you, Dr. Claros. So now we can look at what a family nurse practitioner does, which this is a nurse practitioner who specializes across the lifespan. So family medicine. So family medicine, again, we go from birth to adult to geriatrics. This program specifically will prepare you as a primary care family nurse practitioner, meaning that we take care of a lot of health promotion. We learn about prevention, and learn about, acute illnesses in populations and health maintenance in the family population that you would see mostly in an outpatient basis. What I usually will tell people who are kind of inquiring what an FNP knows or what their knowledge base is, in the simplest way, I say we know a little about a lot. So we kind of see, this whole, every generation, every life stage for, these common illnesses and also acute illnesses and maintenance. And we know a lot about what we specifically would be doing in managing in a primary care setting. We do have the opportunity to specialize, which is always great. So again, if you find yourself, wanting to work in a specialty population, you certainly can. We have people working in internal medicine, which is just adult and geriatric. We have specialty clinics. We still work inpatient hospitalists, nursing homes, and so on. So there are a lot of opportunities. It doesn't just need to be in your basic outpatient clinic, but when you are obtaining education from Mass College of Pharmacy in the FNP program, we really focus on that prevention base on top of, learning to manage acute issues in populations along with leadership and social determinants of health, the things that affect populations on an everyday basis, not the time where, someone's coming in for an emergency and you'll never see them again. So again, those populations where you can foster relationships and take care of somebody, from potentially their childhood to them being an adult, which is such a nice opportunity. So for the FNP program in general, There are two program options. We have the basic MSN program, which requires your Bachelor of Science in Nursing, and the CAGS program. That requires you to have a Master of Science in Nursing. So let's say you're a PMHNP and you decide you want to add that family nurse practitioner degree on top of that. That's when you would come and get your CAGS, we call it. Again, the start term is all 3 semesters, spring, summer, or fall. It is a 24-month program. And in the program, there are 750 clinical hours. So it's a bit of clinical because we want you to have that real life experience. Your first 2 semesters, you will not have any clinical courses. You will have a science-based course, and you would have a, we call them scholarship-based courses, but it's when you would be learning your base. And that's when actually both tracks are merged together. In your 3rd semester is when you start clinical. Again, the PMHNP and FNPs are also together there and doing their health assessment work, which is their first clinical course. Only a small portion of those 750 hours, but basically teaches you, the advanced practice of assessment, just going from what are your RN skills to getting into, what are those advanced skills that you are building upon from your current knowledge base. This begins in your 3rd semester. Again, we cover across the lifespan. So we're looking at PD to Jerry. No prerequisite coursework is required unless, again, you are a CAGS, then we will be looking at transcripts from wherever you had received your MSN from. And then after that initial 3rd semester is when we break off into our track specific courses. And for our FNP courses, we'll go into adult medicine, and then we go into pediatrics and women's health and look at those special populations. And finally, geriatrics. In your last semester, we do allow the opportunity to do a specialty rotation for some of your hours if you're in good academic standing. So we've had students do dermatology, oncology, OB, women's health, PD, whatever they really feel like they might possibly want to pursue in the future, if they feel like it could be a career for them, or even in the case of dermatology, that's very helpful in primary care, getting a little bit of a brush up on the 8,000 rashes that exist, and maybe you want a little bit of extra practice in them. So we provide a lot of really good clinical practice along with our hands-on residencies, which is really nice because we can come together on campus and actually see each other face to face as opposed to just over Zoom. So I believe that maybe is the FNP program in a nutshell in 10 minutes. So I'll hand it off to Dr. Claros to talk about the PMHNP program.
Thank you, Professor Scola. So the PMHNP program follows a similar track as the FNP program. We start out with the foundational courses for the students in the traditional master's program, and for the students that come in with an MSN who are in the certificate of advanced graduate studies, then is based on the program evaluation for them and the transcripts and where they need to start. But for the most part, I'm going to address those that are in the traditional program. They take the foundational courses, the 3 Ps as we call them. So it's advanced patho, advanced pharmacology, advanced health assessment, in addition to other courses as well, like policy, enroll, and some of the others that you will see when you enter the program. Enrollment is the same, similar, the same schedule as the FNP. The program length is the same. It's a 2-year program. And I know Professor Scola had mentioned before, and Dr. Frechette as well, that for the student that is depending on their life circumstances, they have the option to go to 1 course per semester, or they have the option to, some of them have the option to cut down on their work hours to be able to complete the program in the time that they want. The program, it's challenging, it's rigorous. We do also have 750 hours of clinical that is spread out in the various courses, beginning with your advanced health assessment course. And then for after that, the students enroll in the counseling course, which also has a number of hours of clinical hours, and they move from there on to the actual psychiatric mental health nurse practitioner core content per se. There's two courses there. One is the beginning of courses where you see, for example, certain mental health disorders. And then the following course after that, then you pick up from that and you go into an in-depth look at more chronic and acute mental health issues. Not, depression can be chronic or can be acute, but we're looking at more of the life debilitating disorders such as schizophrenia and some of the other cognitive disorders. So again, we talked about counseling course. We do have a course. It's an introductory course where the students mostly learn about counseling techniques. What are the ways to talk to patients? How to counsel them? What theory? What method to utilize based on what? We cover issues of cognitive behavioral therapy, motivational interviewing, and a number of other techniques to be able to help patients with that. We're always looking at, obviously, paying attention to cultural sensitive practices and any legal issues such as informed consent and some of the other things that we deal with in terms of mental health. Included in the program are definitely health promotion to mental health, disease prevention, all the levels of prevention, primary, secondary, tertiary levels of prevention that you learn. Perhaps if you refresh your memory in your BSN program, those levels of prevention continue to follow as you are in the graduate program with the PMHMP program. So I think that same thing, I think it wraps it up pretty much. If I forget to tell you to cover something, definitely will be available for any questions after. Thank you.
Thank you for that.
So for the clinical experiences for MSN or CAGs, clinical does take place in your community, and you'll attend clinical during the daytime or evening that best suits your needs. Shifts are limited to 12 hours, 1 to 2 days per week at the clinical site for clinical courses requiring 75 hours, 2 to 3 days a week at the clinical site for all other clinical courses in their program. So again, you'll be getting 750 clinical hours total. That's a recent change that the school has adopted. All of the schools of nursing for MSN programs have, approaching to that or have already adopted that. It's from our accreditation bodies, CCNE, because again, we are accredited, and also the nursing faculty organization. NOMF also contributes to that, so that when you are graduating from our program, you're going to be a confident, competent provider, hit the ground running, more or less. So you'll identify the clinical sites and preceptors as a collaborative process between the student and clinical coordinator. And we always highly encourage to search for preceptors early, but you will work with, again, the clinical coordinator placement, because there's a process in place, a clinical intent form. But a lot of times students find preceptors by networking, in their own community. Again, sometimes, they'll, I don't know, even at your own community, like the local mental health community center, again, if it was for mental health. But if it was for family, it might be, you might have networks or connections with your provider of care and all of that. So a lot of it is networking, but we also have an extensive database of clinical sites where we have clinical affiliation agreements, and we work with you. So some example of clinical sites, for example, for family nurse practitioner would be the primary care offices. long-term care and assisted living facilities, adult day health programs, outpatient specialty practice, internal medicine, OB/GYN offices. And for the psych, mental health nurse practitioner, again, community mental health centers, inpatient psychiatry, private psychiatric practice, outpatient clinics, psychiatric consult services. Sometimes it can be working in the emergency room, state psychiatric facilities, correctional facilities, and VA facilities. So there's a large array of settings.
Okay, hi, I apologize for being late. My name is Kristen Motson. I'm the student services specialist for right here for the School of Nursing, and I'm going to talk about the mandatory residencies that Professor Scola and Dr. Claros and I'm sure Dr. Frechette touched upon. There are 3 residencies that are required. These residencies vary in length from 1 to 3 days. They, as of the spring 2025 semester, Residency 2 and Residency 3 will be in person on our beautiful Worcester campus. And the first residency, which is orientation, will be online. So just a quick, brief explanation about the 3 residencies. Residency 1 is our program orientation. In addition to giving you orientation to the program, we have speakers that come in from different departments throughout the university so that you have a good idea of all the different support systems that we do have for students here. And as MCPHS students, you are eligible for all support services, even though you may not be stepping on campus every single day. So you are eligible for all of them and you're paying for it, so definitely take advantage of them. For the second residency, this will be done at the end of your first year, typically for most students, depending on your plan of study, but you can plan on doing your residency 2 after you complete 703 advanced health assessment. And that residency will be in person on the Worcester campus. And your final residency will be at the completion of the program, right when you are ready to graduate, walk across that beautiful stage at the DCU Center. That will also be in person on our Worcester campus. Residencies are important. They cover topics that apply to current practice and current NOP competencies to make sure that, as Dr. Frechette says, you will be competent and confident providers when you go out into the field. We do need to make sure that we're meeting not only the NOP competencies, but the competencies for our CCNE accreditors. So the residencies contain kind of information that covers a lot of the a lot of important topics in practice, as well as topics that are very important to our accrediting bodies. For one last thing, for the RN to MSN students, there is an additional residency. The first residency, once you get into the RN to MSN program, is the orientation itself, so that the RN to MSN students have an additional residency and additional orientation, but they are required for RN to MSN students.
Thank you, Kristen. And that both orientations are online for both of those. Yep, especially for the RN and MSN. And one other quick note I just wanted to mention, as Kristen had talked about, that all these residencies are now in person. Just wanted to clarify that because this has been a recent change. So in some of my communications to students, particularly in the psychiatric mental health nurse practitioner or the CAGS, I had mentioned that it had been as far as that it was online or virtual, but it has since changed, which is great news. So that way you can collaborate with your team and with your group and your cohort. So just wanted to make note of that, in case some of you were thinking, wait a minute, that doesn't seem right, but that is just a recent change and an update. We're excited to offer that.
Yes, absolutely. Thank you so much for that. As you know, as nurses and in the nursing field, things change very quickly, mostly on a dime. So I appreciate that clarification. Thank you so much, Cheryl.
Sure. Kristen, did you want to mention about the Doctor of Nursing Practice program?
Yes, absolutely. Glad to. We have a DNP program, our Doctor of Nursing Practice program, which is all online, which is fantastic. It's designed for, I don't want to read the entire slide, but it's designed for advanced practice registered nurses that are looking to kind of reach a higher level in the nursing profession. There is a focus on organization and systems in terms of leadership, and it will prepare you to deliver innovative direct care and explore different opportunities for quality improvement, research, improving a diverse population outcomes, and an opportunity to advocate for policy change, which, as you know, as psych and family nurse practitioners, when you will become them, it's very important for you to be able to advocate yourself as well as your patient. The program starts in the fall. It is 24 months, 36 credits over those 24 months. The curriculum is designed with 2 courses per semester. As Director Fischette mentioned previously, as was talked about, if there are adjustments that can be made for different kind of life circumstances, we understand that things, again, can change on the turn of a dime. So if you do need to alter your program of study, that's something that we can absolutely discuss to make sure that this fits into what you're looking for a time frame. Let's see. There are 1,000 hours of experiential clinical immersion that are required. 500 of those hours will come from your previous nurse practitioner program and does get applied. There's a specific process to do that. You work with Dr. Bonnie Laurent, who is the program coordinator for the DNP program. So she sorry, I lost my train of thought. So if you do have specific questions, please feel free to reach out to myself or any of the graduate team, or actually directly to Dr. Laurent or Cheryl as well. We're happy to answer any questions if you have any specific questions about the DNP program, but we're excited to offer that to our students.
Thank you, Kristen. All right, and the team. Now everyone, now that you've kind of learned about all our programs, and next up, how do you apply? I'm sure that's your next question. So for our Masters in Nursing and the Certificate of Advanced Graduate Studies programs, first step is to go to the MCPH website and just type in search application and submit a graduate application. So you're going to click on the field that's for the graduate applications, and that just basically starts the process, and it's going to be asking for your general information. It takes maybe about like 20 minutes to fill that out. And then we're going to need for your application is your official transcripts from all colleges and universities attended. And when we say all, we mean all. Even those few courses that you've taken at the community college or possibly online, we want to give you the acknowledgement for all of your academic achievements. So send those all in. If they're missing a few, we will wait until we get all of that to process your application. Also, a personal statement of at least 500 words on why you want to pursue a healthcare industry in this field. And also a copy of your encumbered RN license, 1 letter of recommendation, a resume, or you can also complete in the application the work history section on the application. So either one is sufficient. And then that is it. No test scores, no prerequisites here, no fees. It is free to apply. Very simple and easy. One of the callouts we definitely think is an important factor that we do want to mention, that there are certain states in which we can and cannot accept students into our program. So as of right now, here is the list of the states which we can accept students from. Unfortunately, each state has its own state-specific requirements and regulation, and as a result, we do not offer it in every state. So take a snapshot of this, and hopefully your state is located here. And then for the application for the DNP, again, first step, go to the MCPH website, fill out that graduate application. And then again, we will need all of your official transcripts. We're also going to need those to include a bachelor's in nursing as well as a master's in nursing degree. Your personal statement, again, why you want to pursue this field. And then a copy of your AP RN license and current national certificate as an advanced practice nurse, 2 letters of recommendation, and again, your resume to be completed as well. This also has a geographical eligibility as well. These are the states listed that are eligible for this program as well, that are as of today. So the admission details, just gonna review these. So if you have a degree from a accredited college or university we only require an associate's for the RN MSN Bridge program. And then we just need for your Masters of Nursing for the FNB or the PMHNP, the Bachelor's of Nursing. And then for your DNP, if you're interested in that program, we need a Master's of the Nursing, as well as if you're in the Advanced Certificate Studies program as well too. GPA requirement is a 3.0 at higher. Also important deadlines, just keep in mind for spring, November 22nd is the deadline to get your application in. We do have orientation on December 4th, so we need to have all applications in, and we all need to get you all set up and ready to go and into our system and I'll get all your credentials. So that date is kind of approaching. We're actually at October 23rd, so it's less than a month away. So keep that in mind. And if you need help with any, or if you have any questions in the admissions process, again, I have my contact information. It's going to be coming up that you can definitely reach out to me with. And plus, I will be sending you an email with this webinar as well. So a great way that we can connect. So just keep in mind, if you're applying for spring, November 22nd is fastly approaching. And then also September, if you were looking for the summer, it would be for April 1st is the deadline for your application. And in the fall, it's August 1st. It is rolling admission. So what that means is that once you submit your application, within 2 to 3 weeks, you will get your decision. Again, once you submit your complete application, you will get your decision in 2 to 3 weeks, which is great. So that way you can make some decisions and you can go forward and plan ahead in as far as your years to come. Oops, one other quick thing I just want to mention here. There, as we had talked about, no prerequisite coursework is required. Just as far as if you were going to pursue the DNP program, we do require that you take one course, which is a research method statistics course, and you need to receive a grade B or higher. Other than that, there is no prerequisite coursework. Again, no GREs. And one other quick note for the DNP program, there would be a interview requirement. Lastly, tuition and financial aid, obviously a big concern for everyone. And you know, how much does this cost? So tuition is currently $1,160 per credit hour, excuse me, and that does not include fees. And you pay at the end or the beginning of every semester. So if you're only taking one course, just know that that's what would be required for your billing. The fees for the online students, you do pay a $500 enrollment deposit once you've been admitted and you go forward to accept. That deposit though for $500 also goes towards your first semester's tuition. So it does not, there's no loss there. It just locks your seat into the program. Once you place that deposit, we then set you up in the system and get you all your credentials and get you ready for the program. Also, just kind of note that there is currently a $330 equipment books that may be needed for the program. Also, tuition is subject to change, so it's best to always refer back to our website and the most up-to-date. So just type in Google MCPHS, tuition and cost. If you click on the tab that's for the online, you will see exactly how much the online is per credit hour. Also, importantly, financial aid is available for some of our graduate nursing programs. And you can apply by going to the studentaid.gov and add our school code, which is 00165. And you use that code and then we can work with one of our one of our counselors for financial aid, and you can set up an affordability appointment with them specifically to talk about your unique situation as far as your financial aid, and then also some other opportunities or some options. Also, lastly, just wanted to mention, as we know that funding is a very important piece to take into consideration when looking at this program. but don't let it intimidate you. Remember, this is an investment of your future and your career. MCPHS is actually ranked number 3 for the return of investment, which goes to show you that our students are doing very well from themselves post-graduation. We have one of the lowest loan default rates also in the nation, which is very promising. So again, as you navigate through this process and have any questions, don't hesitate to reach out. Our Student Financial Aid Service Department is always just a phone call away or an email away, and you're welcome to schedule an appointment with them, as I mentioned, on our website. All right, with that being said, we're gonna wrap it up. Gonna send everyone, take a screenshot of this, of my contact information. Again, I will be sending you out an email with this webinar that'll have this information as well, but take a screenshot. But happy for us to connect if you have further questions. And I am gonna take a peek in the chat to see if we do have any questions. If you do have any questions that we haven't answered through this presentation, please go ahead and put them in the chat right now, and we'll be happy to address them. All right, I'm gonna pass it back out to our nursing team. Does anyone else have any last minute thoughts or felt we missed something or didn't cover? If not, then I'm going to go ahead and wrap this up. And I just again want to thank everyone for attending today. And we look forward to seeing your application in the future. And please reach out again with any questions. Look forward to my email within the next week or so. And thanks again for coming today. Take care.
Bye, everyone.
Bye. All right.
Sorry, my dog was barking. I have to keep, you can hear her all the way up here. I knew if I talked, Cheryl, she'd start. She hears my voice.
That's so funny. That's great.
It went well, though, I think.
I think we did okay for the first go
Yep.
around. I apologize if I was reading a lot. As soon as I get better, I will be better at it. I just
Don't
wanted,
worry.
I had it as my comfort, just so I knew
Yep.
I'd make sure I didn't miss anything. So, but I think we got everything in there and covered. We had 9 people.
Wow, excellent.
That's a
Excellent.
great turnout. It's a
Well,
great
fingers crossed, you'll hear from them.
Yes, it was great. I got all their information, so I will be connecting with them for sure and seeing where they stand. So, yeah.
Great, Cheryl.
So
Well,
great
Thank
job.
you.
Thank you everyone for the in and out and all your support today. Really appreciate it. It's so hard to get everyone down for this, so I appreciate it.
No worries. Have a
All
great
right.
Thank you.
Have a good
Bye-bye.
evening. Thank you.
Bye.